Hi, my name's Sara, and here at Neuro Rehab Therapy I am in charge of all our data collection. I am a TOMS trainer. TOMS stands for Therapy Outcome Measures, and the reason why I've been given that hat is because before I got into this area I was a research scientist for the Ministry of Defence, and I also worked as a research scientist for the Natural Environment Research Council collecting data for climate change models. TOMS measures 5 different areas. It measures impairment, which is the condition itself. So if we were talking about autism, a 0 would be the most profound case of autism, and a 5 would be no autism. So TOMS scale is a 0 to 5 scale. If they had an impairment of 1, that would be a severe presentation of that particular impairment. 2 is severe moderate, and then we've got moderate, and then we've got mild, and then we've got, as I said, a 5 is no impairment. So impairment is measured, activity is measured. That is the person's ability to carry out age-appropriate everyday tasks. So for example, if it was a child of 8, you would expect them to be able to get dressed, to be able to brush their teeth, to be able to go to school and do those activities that are appropriate for their age. If they're an adult, then whatever an adult of that age is supposed to be able to do. So we've got impairment, activity. The next measure is participation. That's the person's ability to socially participate in their community. So they can make friends if that's appropriate for their age. So, if they're above 5 or above, they should be able to make a friend. They should be able to give eye contact. They should be able to do all the things that are socially appropriate for their age. And the other thing we measure is wellbeing, so the mental health of that person. Professor Pam Ennerby at the University of Sheffield, it's TOMS is her scale that she developed, and it uses the World Health Organization's International Classification of Function codes. And the only thing that she added was the well-being category. And they also added a final category, which is carer well-being. So if it's a child, then we look at the well-being of their main carer, and 9 times out of 10, that's mum. So just to recap, the 5 measurements that we take are impairment, activity, participation, well-being, and carer well-being. So we have been taking TOMS measurements, and the biggest group we have at the moment initially is autism diagnosis, ASD. So our initial results for those is that in a 12-week period, the improvement in impairment has gone up by 13%, and on average that went from a severe to a severe moderate presentation of that condition. That in itself, we were just absolutely, first of all, really happy for the families, but for us, it just confirmed what we thought we knew, is that this works. Their activity improved by 8% in that same period, their participation by 13%, and their well-being, which is such an important one, by 17%. And actually our greatest improvement was in the carers' well-being, which went up by 25%. When I was down in London training to use TOMS and training to become a TOMS trainer myself, the gold standard, if you like, was to maintain. So to get these sort of improvements in a 12-week period, we're just so thrilled for those families and what it means for those children and their everyday lives and the people around them, because the diagnosis is not just for the individual, it has a massive impact on the whole family.